Welcome to Conference Highlights, recorded in front of a live audience at an evidence-based perioperative medicine, that's EBPOM conference. EBPOM are world leaders in perioperative education, so why not join us at our next meeting with a special discount for Top Med Talk subscribers. Look us up on www.ebpom, that's EBPOM.com. Top Med Talk.
I'd like to welcome to the stage Dr. Susanne Mcdonald, who's a psychologist from Queensland in Australia.
Yes, thank you. So it's very lovely to be here today at such an amazing event. I'm really pleased to be able to speak about a study that we've just had accepted in the Journal of Anaesthesia. And it's on the subject of patients' views about preoperative versus long-term behaviour change. And this is a study this was a multidisciplinary project that involved many different people. It was funded by the Preoperative Association. And if you want to read more about this study, you'll see this soon published. This study was on the basis that we know that there is compelling evidence linking unhealthy preoperative behaviours to poor post-operative outcomes. So, for example, there's a lot of studies that show that physical inactivity is associated with a poor outcome, as well as other behaviours, for example, smoking and alcohol. But actually what we really need to focus on is the fact that a lot of people have multiple unhealthy behaviours. So obviously when someone presents with multiple unhealthy behaviours, the risk of poor post-operative outcomes might be quite high. So knowing that unhealthy behaviours cluster together, there is a good chance that many of the patients do present with multiple unhealthy behaviours. So we do need to focus on changing these multiple behaviours, but it is quite a challenging task. However, we might have a really good opportunity to intervene in this period. So surgery may represent a teachable moment. It's very much the case that people tend to favour an outcome that is more immediate than more distal. So when we're thinking about surgery being an opportunity, it may be the case that people feel that they could achieve behaviour change within this restrictive time period compared to when we ask them to actually change their behaviour forever for a general health benefit. So this is kind of what our study wanted to look at. We wanted to see whether there was a difference in people's views towards changing behaviour in this short-term period compared to this longer-term period that we often usually ask patients to do as part of our public health messages. So there aren't very many studies looking at this in the prehabilitation area, especially in relation to their attitude towards multiple health behaviour change. So the first research question in our study was to look at whether patients' views differed according to these different temporal framings of messages. So do people favour making short-term changes for post-operative benefits compared to the general health benefits they would achieve from long-term behaviour change? So we wanted to compare those two temporal frames within the same participant. And the second question was looking at how motivated people feel and whether they were more motivated than they were confident to actually achieve those behaviour changes that we would recommend them to adhere to. And this is something that's really important because we may find that our patients are very motivated, but they don't have the confidence to actually achieve the behaviour change that we require of them. So the method of the study was that we were recruiting participants who were scheduled for surgery, who were over 18 years old and could give informed consent. So they were recruited at pre-assessment clinics at 3 different hospital sites, and we gave them a really structured questionnaire that elicited views about behaviour change. So we weren't just interested in the individual behaviours like physical activity and weight management, smoking and alcohol, but we were also interested in their view about how they would feel changing multiple behaviours at the same time before surgery, as well as in the long term as well. So we did have a very specific focus on their motivation levels as well as their confidence. But another key factor that's important that we find in the literature is that people tend to have a very it's very important for people to prioritise behaviour change, and then they will be more likely to achieve it. So that was another feature and concept that we wanted to look at. And in this study, we looked at people's views in two temporal frames. So the first temporal frame was the short-term post-operative health benefits. So that enabled us to look at how willing people would be to change behaviour in the 4 to 6 weeks that we gave as an example before surgery, as well as looking at the other temporal frame, which was the long-term benefits that people would achieve from changing their behaviours in the long term. So the general benefits that we hear about all the time. And this was an intra-individual comparison, so that we weren't comparing participants against each other. We were comparing them at the same point in time on their views about the short-term change and the long-term change, and the benefits that would result from those changes. So as you can see here, we had 299 participants in this study. And I won't read out all the demographics here, but you can see that we had a wide range of age in our samples. So we had 19 to 91, but with the majority of people being a bit older, because you can see that our mean age was 68. And the majority of the sample were scheduled for major surgery. And in terms of their individual unhealthy behaviours, we looked at what they were doing at preoperative assessment. And you can see here that physical activity was quite low in some people, and this is self-reported, so it could be that people were reporting that they did more than what they actually did. And in terms of the body mass index, we can see that most people were in the overweight or obese category, so obviously at risk of poor post-operative outcomes, with 13% being smokers and 17% of people having a hazardous intake of alcohol at that time. When we look to see how many people are engaging in a certain number of behaviours, these unhealthy behaviours at baseline, we can see that 87% of the participants were engaging in at least one risky health behaviour at that preoperative assessment. And actually, when we look at how many are doing multiple unhealthy behaviours, we can see that 42% of our patients, so nearly half, are engaging in at least 2 risky behaviours. And this is self-reported, so it could be underestimated as well. So we'll need to remember that there could be even higher levels within each of these categories. So when we statistically looked at the difference between people's views between the short term and the long term across all the behaviours that we're interested in, and in motivation, confidence and priority, we can see from the slide that there is a significant difference in all the behaviours except smoking. So between the 3 behaviours there, we can see that there is a significant difference with people favouring the short term compared to the long term. So we also looked to see how people felt about the multiple behaviours, and as you can see here, people were more motivated, confident, and placed a higher priority on making a multiple behaviour change in the short term compared to the long term. So I think this suggests that we have a really good opportunity to intervene with a multiple behaviour intervention with these people. When we look to see whether people's motivation and confidence levels differed across the different behaviours, we can see here that most people had a higher motivation to change the behaviour compared to their confidence level. And this gives us the indication that we might need to provide a lot of support to people, because they may be highly motivated and we don't really need to convince them to change their behaviour, but we might need to support them and build their confidence in order to do so. We can see that it was the opposite relationship for alcohol, which is an interesting feature of the study. So in terms of the implications of this study, we do find that there are favourable attitudes for short-term behaviour change, except for smoking. But this does suggest that there's support for surgery being a teachable moment. So this is very exciting to find support for this. And in terms of the motivation that people have, it's good that we know people are quite motivated to change their behaviours, but we need to find a way to translate that motivation into action, and we need to be able to support patients to do that, and that might be something that we need to do further research in order to achieve that. And some of the challenges are that multiple behaviour change research is still in its infancy, so we still have a lot of work to do to identify the most optimal way of approaching multiple health behaviour change. So for example, there's some research that looks at whether we try to change behaviours all at once or do we do it in a sequential pattern. And obviously this is quite a big question for us because we have a limited time prior to surgery. So it might be that we don't have the option to do it in a sequential approach. We might have to try and do it all together. And there is some research suggesting that there is a relationship between the number of behaviours you're wanting to change in a patient and the willingness they will be able to do that. So it's something that we need to look into in the prehabilitation context in more detail. And also there's the open question of who will deliver these interventions and what will they look like. So that's something that we can look at in future research. So thank you very much for listening, and thank you.
William Jerrison here. Thanks for listening to Top Med Talk. Now, before we let you go, it's important that we remind you to subscribe to Top Med Talk. That way you'll never, ever miss another episode. Also, if we could encourage you to join us on social media, Twitter, Facebook, LinkedIn, YouTube, pretty much every single social media platform, we're there. Join us. And finally, check out topmedtalk.com. If you go to our website, you can subscribe to email updates. That way we can always tell you where we're going to be, what we're going to be doing, and how you can join us. topmedtalk.com and click on the section marked email updates. Finally, Top Med Talk is proud to act as the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about them as well. ebpom.org is their website. That's ebpom.org. And if you go to ebpom.org/meetings, you can find out about some of the wonderful meetings that we attend and cover across the year here on Top Med Talk. That's ebpom.org/meetings.